And we've had nurse practitioners working in the emergency department forever, supporting, physicians in the emergency department. What is the potential role for a nurse practitioner or a PA working with an EMS?
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing, and thanks for joining me for another episode. Really appreciate you being here. As always, I got to remind you, don't forget to make sure that you get on iTunes and leave a rating and a review for this podcast. That is how other folks like you are going to find this podcast. And always don't forget to recommend this to a friend, people you like, people you don't like. You know the story. I have a great episode planned for you today. As you may know, my background before I became an ER nurse was as an EMT and as an EMT instructor. And I've often said that sometimes I felt like I have more in common with my pre-hospital provider friends than I do other people maybe upstairs in the hospital. We have a very similar role between the pre-hospital providers and providers in the emergency department. And my guest today is someone who kind of lives in both worlds. So my guest today is a nurse practitioner who works with an EMS program. And this is a cool and innovative way to use nurse practitioners that I'd never heard of before. So you are going to really enjoy this episode with my friend, Chivas.
Well, my name is Chivas Guillote, and I'm born and raised here in Houston, Texas. I'm a nurse practitioner and a paramedic. And I started my career in EMS, and then I became an RN, and then I became a nurse practitioner later. I work today as the Vice President of Clinical Services for Harris County Emergency Corps, which is an EMS system based in North Houston. And then I'm also an emergency nurse practitioner in a small critical access hospital in East Texas. That's CHI Memorial Health St. Augustine, and we cover the emergency department there with 4 different advanced practice providers on a rotating basis. And then I'm casual faculty at UT Houston in the emergency nurse practitioner program there. And then in my spare time, I'm a doctoral student at Johns Hopkins University.
Oh, Lord. Holy cow. You are keeping busy, aren't you?
I am busy, but I'm almost done.
Good for you.
Yeah.
There's a friend of mine who was in Colorado and now is in Wisconsin, who is a graduate of the Johns Hopkins doctoral program. And she is she was like, it's legit. It's hard. So,
yeah, you earn your keep at Johns Hopkins. I can tell you that.
Yeah. It certainly sounds that way. She was doing it, and she was like, this is a lot of work. So, but I guess if it was easy, everybody would do it, right? So
that's right. That's it.
I remember when I was finishing my bachelor's and I was going back for my master's, and the then president of the ENA, and I had happened to have a breakfast together one morning. We were on a work team together, and she's like, she's like, go get your doctorate. And I was like, why would I want my doctorate? I don't need my doctorate. She's like, do you know how many men in nursing have their doctorate? She's like, it's not many. She's like, yeah, you got to do it. Like, it's like, it'll set you apart. You'll be able to write your ticket, be able to do a lot of different things. And she's like, you got to do it. And she's still to this day, it's like, did you do it yet? And I'm like, I went from a hard no to a maybe someday to, maybe down the road. So,
right.
Inching my way towards, okay, maybe I'll sign up for some classes. So, so why? So how long were you a medic before you became a nurse?
I became a medic in 1992, and I became a nurse in 2004. And the biggest push that made me go into nursing was I was working at an aeromedical program in Houston, and I was working on a team that was a pilot, a flight nurse, and a flight paramedic. And I learned very quickly that the pilot was in charge of all things aviation, and the flight nurse was in charge of the medical team. And then we made jokes that the flight paramedic was like the chief custodial engineer. and worked at the flight nurse's bidding, which I mean, we make a lot of jokes about that. There was a time in that program where that was kind of true. The iteration of that program at Memorial Hermann, the flight nurse and the pilot were fixtures on the aircraft. And then they had rotating physicians that were residents that rotated on and off for years in the beginning of the program. And then at one point, the hospital and the university decided to keep the physicians in the ER and off of the aircraft, but they needed to replace that provider. And so they started using flight paramedics as the second medical crew member. And for a long time, they were kept under very tight control by the flight nurse, which is one of the things that helped create the great qualities of the flight nurses that Memorial Hermann had. They were very protective of their patients and very plugged into the care. And working as a paramedic under the flight nurses, I didn't have control over what was going on with the patients. And we worked as a team and worked together, but I decided I wanted to one day be a flight nurse. And so I went to nursing school so I could be a flight nurse.
Good for you. Good for you. That's awesome. It's kind of funny how many flight programs, and most of the flight programs I've heard of really were more heavier to it. Like I remember even some of our docs flying with some of our medics in the day, not necessarily with not seeing nursing as much at the forefront of that. Well, I guess they were too. But I remember when I first started in the emergency department, we had a flight crew attached to our hospital. And I remember one of the old techs that I worked with. Yeah, she goes, she always told people, she goes, yeah, she was an EMT intermediate. And she's like, yeah, I used to work the helicopter. And I was like, you used to work the helicopter as an EMTI? She goes, yeah. She goes, basically they come out to the department and be like, hey, we have a flight. Who wants to go? And somebody from the emergency department would go man the flight. They go put on the flight suit and off they go. And she had her own flight suit because she was like 4 feet tall. So they'd be like, go jump on the helicopter and go get the patient and bring him back. And that's pretty much what they did. And I was like, holy cow. So here's this EMT intermediate who's, on the flight team, doing probably some amazing stuff in flight that I was just like, wow, that's crazy.
Yeah, for sure.
The infancy of flight programs. Now it's a flight nurse and a flight medic and, so regulated and so, good. I mean, there's some really great flight programs out there. So
very advanced. Yeah. The care that people do in the back of a helicopter, the expectation's the same, right? So the care the patient receives in the aircraft should be theoretically no different than what happens in a hospital. You're an extension oftentimes of the hospital. And so that's kind of how they viewed our flight program. And you would be amazed what you can accomplish in the back of a helicopter.
It really is amazing. And I remember the first time I got a chance to go up and sit in a helicopter at the flight program where I worked, I remember thinking to myself, holy cow, this thing is small. And it was the tiniest little, passenger compartment that they were trying to work in. And I was just sitting there thinking, these guys are amazing that they can get anything done.
No, you're right. They're so small inside, depending on the airframe you're working in. And it's just to maneuver around in some of them is really challenging.
Yeah. And I remember the first time I got to fly and I had the bug. I really wanted to be a flight nurse. And that's really why I went to nursing school. And that flight bug left me since then. But I had the bug and I really wanted to be a flight nurse. And that's really why I went to nursing school.
Yeah.
Then by the time I finished, I was like, hey, I think I'm good on the ground.
It's a lot. It's a great career, but man, it's a lot of dedication and a lot of time.
Yeah, a lot of dedication, a lot of time, and certainly some amazing providers I've seen come through flight programs for sure. So what's your role now? So you said you work with Harris County EMS now. What role does a nurse practitioner play in the EMS system? Because I've never heard of that.
Right. So Harris County Emergency Corps is a private, not-for-profit EMS system that covers about roughly 450,000 people in North Houston in the unincorporated north part of Harris County. And so the City of Houston Fire Department and HCEC have stations that are essentially right on top of each other in North Houston. And so if a call originates in the city proper, then the city goes to it. And then if it's a call that's in the county, then we go to it. And in my role there, I'm the VP of Clinical Services. And so in our org chart, we have our CEO, and then we have 3 vice presidents. There's a guy over operations that covers, the daily deployment of ambulances, the communication center, all that kind of stuff. And then there's a VP that manages the administration side of the house, all the HR and all that kind of billing components. And then my work group is clinical services team. So anything related to the provision of patient care falls within my work group. And that also includes the onboarding of our staff. It involves medical direction. It involves our community health paramedic program, our clinical education team. And then within our community health paramedic program, we have a nurse paramedic that's kind of like a case manager and manages really, really unusual patients in our EMS system. Some of which are just high needs patients, some of which are system abusers, and we try to plug in resources to help them navigate through the healthcare system. And on occasion, I'm asked to assist him with some of his patients with referrals or trying to create alternative dispositions. And then as a nurse practitioner, I work with our medical director, Dr. Decker, in a medical control capacity. So when our crews want to be able to phone a friend about a particular patient they're taking care of, in fact, that's why I stopped a minute ago, because I thought a consult was coming through. They ring a phone number that simultaneously rings the medical director and I and one other staff member, and we get on the phone with the crew and we walk through whatever their challenges are. And they usually, sometimes they call with knowing what they want to do already. And then some other times they're kind of at a fork in the road and, they want an opinion on what you think they should do.
That's awesome.
So it's really nice to be able to help Dr. Decker and extend his reach a little bit by being able to kind of augment what the crews do in lifetime.
That's awesome. Now, is that a unique role, using nurse practitioners in that medical direction kind of role? Because I've never heard of that. And I spent, my part of my background before I became a nurse, I was an EMT and did EMT. I was an EMT instructor and did EMT state, worked for the EMS Bureau in New Mexico. And I've never heard of a nurse practitioner serving in that role.
Yeah, so it's certainly an evolving specialty. If you remember, probably 7 to 10 years back now, EMS became an official subspecialty of emergency medicine under ACEP. And then at that time, there was a little bit of banter going back and forth of, well, now that EMS is officially a subspecialty of emergency medicine, and so most recently, there's been some activity at both the National Association of EMS Physicians, and there's also been a little bit of activity at the American Academy of Emergency Nurse Practitioners, and looking at exactly that. And then within the PA group, SEMPA, which is the Society for Emergency Medicine PAs, they've also had some activity looking at how APPs can support the medical director role. And some of that is by providing some hands-on medical direction.
I know an awful lot. We, the hospital I used to work with had a PA program, and their PA program really liked pre-hospital providers. So there's a lot of EMS guys ended up there as PAs. That was just like a great combo for them that they really liked. So I'm not surprised seeing PAs taking an interest in what's going on pre-hospital, because a lot of those are old pre-hospital guys.
Yeah, for sure. And to ask or to answer your previous question, you'd asked about is this relatively new, and it certainly is. But I am aware of some other places that do have nurse practitioners that are working in EMS. And one example is in the city of Baltimore. There's a joint venture between the hospital and Baltimore Fire, and they have a couple of nurse practitioners that see patients in the field along with the Baltimore Fire Department. And then also LA Fire Department has nurse practitioners that actually staff their ambulances and run calls to try to dispo patients before they have to make it into the ER. So if they have some some things that they can dispo in the field, they'll take care of them at home.
What a cool, unique way to do a couple of things. One, it decompresses the emergency department. That is, of course, now even with COVID, more so than it was when I was full time in the emergency department, and then we were bursting at the seams. What a cool way to basically take somebody and be like, hey, you know what, we understand that you want to come to the emergency department. Really, here's what you need. Like,
right.
we have a nurse practitioner who can see you here, get you squared away, get you started, and start kind of working on your health. But may not necessarily need to bring you in.
Yeah, for sure.
What a cool concept to try to help relieve this, the already very, very stressed system. So,
yeah, think about the open laceration that, takes 20 minutes to sew at someone's house. If you have all the right material to do it, you don't have any need to do any imaging. I mean, that's an easy prevention of having to send someone to the ER that could easily stay at home with some follow-up.
Yeah. Now, I know a lot of communities are doing kind of more a paramedic role in that, where they're doing more like a community health paramedic. How does this fit into kind of that? If there's a place that has that kind of model, which I was a little bit familiar with, the PA program kind of was where the PA program in the medical school was kind of working on trying to get a community health paramedic program kind of up and running a long time ago.
Community health paramedic programs are phenomenal in trying to meet the needs of the community. And if you've seen one community health paramedic program, you've seen one community health paramedic program.
Yeah.
And what's been interesting is that depending on the community that you live in, the needs of that community are very different. And so it's very hard to make a one size fits all solution on what a CHP program should look like. In our system, HCEC's patient population is one of the most desperate populations in the city. So we have very, very poor access to healthcare. There's very few health system related clinics in our area. There's very little preventative care. And we have a huge population of undocumented immigrants in our system, which makes it really difficult for them to want to access the healthcare system. They don't want to call 911 because they fear deportation. Yeah. And so a lot of times our patient population will wait till the very last minute to call 911 because they're worried they're going to get in trouble.
Yeah.
And so we arrive oftentimes at very under-resuscitated patients and that are really, really sick, or we find ourselves in these unusual situations of where people with really complex healthcare needs need healthcare navigation, and they need someone that's willing to show them the steps necessary to get a primary care doctor and to have referrals and to avoid being able to go to the ER all the time. So I think the nurse practitioner in that sense can extend the role that the community paramedic plays by assisting with that healthcare navigation piece and temporarily providing some primary care till they can get them plugged into the health system.
Yeah. Now, does the program you work for now, do they do community health paramedics? So they do community health paramedics, and then they're kind of backed up by is it more than one nurse practitioner? Is it you and a medical director?
So today it's myself and the medical director. And then our community health paramedic, which the name's kind of a misnomer because he is a nurse paramedic. He's actually a BSN to DNP student. Nice. Going through the family nurse practitioner program at UT Houston. And so when he's done, he'll be another nurse practitioner in the system. And so we'll have two of us, which will be great.
That's awesome. Yeah, that's awesome. Yeah, you mentioned you have nurses in like pre-hospital roles too. Is it more than just him or?
Yeah, so when we have several nurses that work in our EMS system. Some of them are frontline medics on the truck. They were paramedics before. They went to nursing school. They went to work in the emergency department, and they said, you know what, this is great, but I really miss the ambulance. And they came back. And so they maintained their ER jobs in a PRN role or a part-time role, but some of them came back.
Great. Where do I sign up?
Yeah, for sure.
It sounds like
they work hard. It's a busy system, so they work pretty hard.
I bet. That sounds like a lot of fun though. My background is EMS, and man, I loved it. I loved EMS, and that's how I actually got into nursing. As I started as EMT first, eventually went to the emergency department, and just fell in love. Like, it was just like, this is cool. I love doing this. So it's, I can see where people would get into it for sure and want to go back to that. I don't know how many times, medics I worked with or I seen going through nursing school, and they're like, yeah, I'm going to get out and be a nurse. And then they're like, yeah, it was good. It was good, like being a nurse, but really miss kind of that. And, then they end up going being a flight nurse or doing whatever else they're doing. So I can definitely see where that'd be a draw for a program. Holy cow.
Yeah. I think nurses and paramedics have really the same personality. And I think a matter of where they land depends on where they get access to first. Yeah.
Yeah. I mean, my whole goal, I was an EMT basic, then EMT intermediate. And my whole goal was, I was working as a tech in the ER. I was getting ready to apply for paramedic school. And I went to my interview for paramedic school, went through all the testing, went to the interview. And the program director, who was a nurse and a paramedic, and he was, brilliant guy. And he's like, so Kevin, what do you want to do? I said, I don't know. I think I maybe want to be a flight medic for a little while, get good at that, and then go become a nurse. And he was like, if like nurse is the end goal, like, why don't you just go be a nurse? And I was like, it's not a bad idea. And he's like, why? He goes, I'm happy to have you in my paramedic class, but why are you wasting my time if you're going to go through the paramedic school and then turn around and just go to nursing school right away? Like, he's like, just go to nursing school. Save your time, save your energy, save your money. And I was like, it's a pretty good idea.
Yeah.
I was like, not a bad idea. And at that time, just decided, I think nursing is probably going to be more for me than paramedics. So it's kind of crazy that there's so much overlap between the two that it's really lends itself well to know the other. So
agreed. I tell people all the time that I am a much better nurse because I'm a paramedic, and I'm also a better paramedic because I'm a nurse. I think that where the education lacks in one area of specialty, the other compensates in a lot of ways.
Yeah. No, I think it makes a really good match. And I think in flight teams, a lot of times you'll see a nurse and a paramedic, and I think they usually complement each other pretty well.
Agreed.
So, but that's cool. What a cool role for a nurse practitioner. So that's definitely something unusual that I hadn't heard of. So when I seen you post something about it, I was like, I'm going to reach out to this guy and find out a little bit more about this.
I'm really glad you did. In fact, that post I put out on LinkedIn, I honestly didn't expect to get much traction off of it. And it was just it was a spontaneous moment in time. And I just like, it's a fun day. It's Nurse Practitioner Week. I'll put a photo out there and say what I do. And I had so many people that answered me back on that post. And I put out stuff that I thought was a lot more important, and I hardly got any feedback on it. And just for whatever reason, this just got people's interest. So it was kind of fun.
Interesting. I think part of it is, I think there's a lot of nurses that have EMS backgrounds that, did EMS or was involved in EMS in some way, shape, or form, and always, really wanted to do that. But I know a lot of people, sometimes would make that change. And sometimes it was just a strictly financial decision to say, okay, I need to go to nursing school so I can make a little bit more money, have a little bit more job stability and that kind of thing, depending on where you work. But, seeing a lot of people who have EMS backgrounds who go into nursing, that's got to really, I'm sure they're kind of interested to go, okay, there's more than just a couple ways to skin this cat. So,
yeah. Within EMS systems, depending on the state that you're in, you may have, a state medical director, you may have, or a local medical director. So for example, in Texas, each EMS system has their own medical director, and that medical director can design the clinical practice for that EMS system based on that community's needs.
That's awesome.
And if you think about it, it means that every EMS system in Texas can be incredibly different from the other. Mm-hmm. And some EMS systems have the fortunate pleasure of having, an EMS medical director on site several days a week. But most EMS systems, unless they're part of a major metropolitan city don't have that much access to their medical director in a lot of ways. And one of the values I think that nurse practitioners can add is being able to be that, in the office resource Monday through Friday that's readily available and knows what the mission of the medical director is and knows how to advance that mission and to support the medical director, I think is where a lot of the value really lies.
Absolutely. I think what a cool alternative role for nurse practitioners. 'Cause how many nurse practitioners go to school as a nurse practitioner and think, hey, I'm going to be, potentially, riding in an ambulance or,
right.
Taking care of folks off the ambulance. Like, it just never done that as something that always occurs to them, which is good. So that's cool.
I think it's the best job ever created.
So how long have you guys had this role in your department?
So, I started this role. I started as the VP here back in 2013. And at that time, I was an RN paramedic. I wasn't a nurse practitioner yet, but my EMS system was very supportive of me going to school. And so when I came out as a nurse practitioner, my role started to transition a little bit. Yeah. And my responsibilities increased in terms of the medical practice of our system. And now it's been since 2013.
Are there any other systems using nurse practitioners in this role?
So yes, within Texas, I'm aware of some nurse practitioners working in a system called Harris County ESD 48.
Okay. So
they're kind of on the west side of Houston out near Katy. And I'm aware of nurse practitioners working outside of Texas. We talked about LA and Baltimore, and there's some other smaller cities that are starting to use NPs. And there's also some flight programs that are starting to use nurse practitioners.
Oh, really? I hadn't heard that. That's kind of cool.
So University of Cincinnati and also Vanderbilt University are both using APPs at some level. Some of them are only using nurse practitioners.
Wow.
And they're putting them on the aircraft.
That's super cool. What a cool role for nurse practitioners, and what a cool role for that advanced level of care, which paramedics and nurses so far have done really awesome in. I've always always thought that'd be a kind of a cool goal to be a flight medic or flight nurse. I always thought would be a really cool thing. So
yeah, that's great work.
Yeah, I bet that's really cool. So, what do you like most about your job?
I like that I'm not super focused in just one area. So I like that I get to participate in clinical practice, whether it's direct patient care, if I'm responding to the scene. I went last week to the scene of an accident where there were a critical patient and then a patient that was dead on arrival, and they required a lot of stabilization before they handed off to the air medical crew. And we were transfusing blood products that we carry, on our supervisor vehicles, and doing all the procedures that you do and really unstable patients, and handed off to the flight team. And then I came back, and then I do some phone consults with crews that are asking about different things, and then meeting with hospital ER directors about hospital wait times for ambulances, and writing policies with the medical director, and then I get to hop over and help teach ATLS.
That's awesome.
Or help do our crew training when we've got new crew members that are coming on board. And so it's having the ability to kind of modify the medical practice. When you're an ER nurse and you're in a bedside role, you're taking care of the patients directly, and you see the effects of your work. And when you transition into a leadership role, you feel like you lose part of that because you're not involved in the direct care of the patient every day. Yeah. And you have to kind of do a reset with your brain. Mm-hmm. And you say, the work that I do now literally affects every patient we take care of.
Yeah, for sure. And there's it's incredible what a difference that position could potentially make. Like, if utilized correctly, wow, what a cool thing. You can be like, look, I get you. I understand you don't feel good, but you don't necessarily need to be seen. But you're getting this from somebody with an advanced clinical skill set that can say either like you're good or maybe you're not. You need to come with us, and here's why.
Right.
So that's really cool. What a cool role. What a cool, innovative role. So where do you see the program growing next?
I think it depends largely on what happens at the national level in terms of if the societies get on board. I think if there's strong support from NAEMSP and from, AAENP, ENA, organizations like that have a really kind of strong footing in emergency care, that we have a real chance of doing some real unique things.
For sure.
And I think the role that nurse practitioners play in terms of their advanced educations, they know a lot about research, they know a lot about policy, they know a lot about evidence-based practice, and they know how to implement quality improvement and so many things that are important to the advancement of an EMS system that is often done solely by the medical director. I think can be done with a lot more help by the nurse practitioners that they have working for them.
That's amazing. That's super cool. So what a cool, innovative role for nursing.
It really gives people a lot of opportunities. If you think about the number of EMS systems in the country, if this really takes off, you're really going to expand access for job opportunities for nurse practitioners, and especially those of us that have experience in EMS. Man, it makes a really great asset to the EMS system to have advanced practice providers that understand the role.
I always thought that I remember as an EMT going through nursing school. I remember thinking to myself how similar those roles are, and there, certainly there's different things and there are different focuses, but just how similar those roles are, and how each one's skill set feeds the next, which I think is really cool.
Yeah, for sure, I agree.
So that's awesome. What do you think the future holds for emergency nurse practitioners in general?
I think emergency nurse practitioners are at a great place in terms of, people recognize us as a specialty. It took a lot of work from a lot of really, really smart people to get EMP to the finish line as a certification. And, there's talk about what are the next steps for, emergency patients as a theoretical population, as a new population for nurse practitioners.
Yeah.
And going beyond, just the certification exam. And I think that'll be an interesting thing to see on what types of providers will be able to take care of emergency patients in the future. So I think nurse practitioners, particularly emergency nurse practitioners, have a pretty strong footing on the emergency care team. I think they have a really, really good opportunity to flourish in EMS if we can get this right the first time. And so I really think that we're kind of in a good spot.
That's kind of cool. What an exciting role. And I hope what this does is inspires some of the nurse practitioners out there, or some of the people who are wanting to go to nurse practitioner school, that's not just all work in the ER. It's not just all, the low level, not low level. That's not the right thing to say. But it's not all the kind of minor care or urgent care like cases in the emergency department. Like, this is like real, honest to goodness, like super cool stuff.
You're right. And I think one thing that really appealed to me in this role is paramedics really like a lot of autonomy. And I've never stopped being a paramedic. And every role I've ever had in EMS, I was fortunate to work in places that really gave us a lot of freedom. Yeah. And I think for those of us that are working in emergency departments as nurse practitioners that came from these EMS backgrounds where we were accustomed to having a lot of autonomy, you find that situation is suddenly very different. And your level of autonomy varies greatly based on, the team that you're working with or the policies of the facility that you work for.
Yeah.
And, unless you're working in a critical access ER or somewhere that, the policies are lined up to let you really use your skills in your practice, it's easy to find those roles that are a little limiting in scope.
Yeah. Yeah. I think one of the things that I've seen, I certainly have seen more and more emergency nurses going into, or more and more nurse practitioners in emergency nursing roles, which when I first started, there just wasn't many. There was a handful, but not many. Now there's all kinds. Holy cow. So, which is cool. I think that's a real good thing and a real advantage for nursing care to kind of make it to the pre-hospital environment, which I think is a cool thing.
And the one thing I would say about just emergency nursing in general, whether it's EMS or within the hospital, is I think COVID-19 really taught the healthcare system a lot about the power of nursing in terms of what nurses can do to help really keep the healthcare systems afloat and moving when, so many sick people are there and so many people needed care and all the staffing challenges that came up. And I think the healthcare systems finally really understood how imperative it was that nursing was on board.
Yeah. I mean, when you think of the potential, the mix of skill between EMS and nursing, it's a natural, hand in glove.
Mm-hmm.
So.
Yeah, I think EMS and emergency nursing really shined during COVID because there was no recipe on how to do this. Yep. And they depended on the personality of people that work in emergency care that can really just move with the punches and adapt. Yep. and act and that's just the skills that we have and the specialty.
Yeah, no, I agree with you 100%. I think it just works. And it's, one of the things we're going to have to realize is we're going to, the systems are stretched thinner and thinner and thinner. And like everybody's feeling that, the more resources you can put into the already existing system, I think the better off we'll ultimately be. So that's cool.
Mm-hmm.
Oh, what a cool! I appreciate you taking the time to talk about this. This has really been interesting.
Yeah, for sure.
It's interesting to hear that this kind of stuff's going on, especially in my backyard, which is really cool.
Right? Yeah, I think in 5 years, this is going to be a really different thing. I think in 5 years we'll have a little bit more maturity underneath us in terms of what nurse practitioners working in EMS looks like as a specialty. Mm-hmm. And my personal hope is that we work towards a pathway for certification to create, an EMS MP credential that really highlights the specific role that nurse practitioners can play within EMS, which EMS is very different than working in the hospital. It's an entirely different set of skills. Yep. And I hope that when programs are beginning to educate nurse practitioners to potentially do this role, that they really forge strong relationships with the EMS systems that are in their communities.
Yeah, they have to. I mean, it's a must for sure. Like you just got, it's the only way it's going to really kind of get anywhere. So That's cool. What a cool role. What a really cool role. I think that's just awesome.
Yeah.
So, but
I'm excited about it. I've ever since I started nurse practitioner school, I thought about how cool it would be to be able to supplement the work the medical director does as a nurse practitioner. Yeah. And I'm thrilled to see that, within the first 5 years of my practice, that it's really coming down the pipeline.
That's awesome. That's got to be really cool for you to see and really cool for you to be a part of. So yeah, I'd seen you post and I was like, okay, this I haven't heard of. This is new to me. I gotta ask some questions about this. So that's really cool. So
I'll have to visit with you in another year and see where we've gone.
Yeah, no, for sure. I'd love to follow up down the road and say, okay, like what now? Like what are the challenges now compared to a year from now?
I think some of the things that we're looking at immediately is how do you bill for the services of a nurse practitioner in EMS? How do you, what are the CPT codes required? What does that look like? And how is it different than the care provided by the current team? And how do you put a dollar on that?
Yeah. And that's got to be hard. I mean, that's going to take way smarter people than me, but that's got to be hard to say, okay, how do we say, okay, this is what that costs?
Yeah.
And then kind of defining the role, because you're kind of in between, two worlds in a lot of ways.
Yeah, for sure.
So
and in some EMS systems, the role is going to be very specific. and the nurse practitioners are going to be seeing a very select type of patient, especially in a high volume urban EMS system, that their role is going to be to manage this slice of population.
Yeah.
In smaller EMS systems, I think the nurse practitioner working in an EMS system could have, again, a much more generalized role of where they have bits and pieces of quality and education and research and care and all those aspects.
What a cool thing to be. What a cool way to really start, kind of digging into some research that really shows, system outcomes. Like not just hospital, not just EMS, but system outcomes. What a cool role. Holy cow.
Yeah. So we just implemented a quality improvement project that's a part of my DMP program at Hopkins. And our EMS system had a before and after in the summertime. So we rolled out a clinical airway bundle for intubation. And we did a before and after looking at our adverse event rate. And I was so happy to get to show our team that when we rolled out this bundle, our adverse event rate dropped like a hammer.
Holy cow.
And showed them, our review of the literature, and showed them, the interventions that we had looked at, and found that there was a bundle of those interventions that you could roll out that would reduce adverse events during airway management.
Yeah.
And again, going back to those theoretical foundations of nursing and evidence-based practice, you can really pull some of those things, and those skills translate very well from nursing into EMS. It's a lot of the same work, and showing people the value add of having people with the education that can roll out those kind of projects.
Yeah. One of the things I found when I was fairly new when I was fairly new to the system as a nurse, one of the things I realized, and with my EMS background, I realized how much overlap there is between the two. But yet, as different as they are, and they both play a part. Like if you can get that right, if you can get a good skill mix between the two, got a lot of potential. So
yeah, absolutely,
that's really cool. So awesome. Well, one of the last questions I always ask all my guests is a question called 3 Things. And it's a question that basically says, what are 3 things a new nurse should always remember? And what are 3 things they can just forget? And if you can tie that into kind of nursing and maybe interacting with EMS or in their interactions with EMS or with their pre-hospital teams, be it flight or ground. What are some good lessons that emergency nurses should remember?
Yeah. So one thing I'd say is when you're receiving a patient from EMS, you don't know where that patient started. And the ambulance crew has 15 to 45 minutes to solve whatever problems the patient has before they show up at your door.
Yeah.
And they're doing that with 1 or 2 providers.
If they're lucky to, most by far 1, right?
Right. And so not everything's going to be perfect.
Yeah.
And this even happens in the air medical world, where you would have flown to pick up a patient that was really, really unstable, and you did all these interventions en route, and you had put in lines and intubated them and done all these things that, it's 30 minutes worth of work done in 10 minutes. And the one piece of feedback, I'll never forget this call. One piece of feedback I got from the nurse that I handed off to was, well, why didn't you guys put in a gastric tube? It's an intubated patient. Why didn't you put in a gastric tube?
Yeah, you're like...
because I didn't have 1 more extra second. But you're welcome to have the stable airway and the very nice lines and the wonderful hemodynamics. And I hope you have a great day.
Exactly.
That's number 1.
You're welcome.
Right. So remember, number 1 is you don't know where the patient started. You just have a snapshot of time of what the crew brought you.
Yep. Yeah.
And then the second thing I would suggest is that nurses remember that the paramedics are just as invested in the care of the patient as the nursing staff or the hospital staff is.
It's really true.
They're more invested in some ways, in that, they started with the patient before you saw them. They had a chance to establish a rapport with them. Sometimes these are repeat patients that they see all the time, over and over and over, and they know them very well.
Mm-hmm.
And so when
every ER nurse on the planet can attest to that.
Yeah, for sure. And when they report off to you and they give you information, listen to what they have to say. And you can always choose to clarify bits and pieces of information, but never discount them. Because if you only depend on your own assessment, you're going to miss important pieces.
Yeah. I think, a lot of times what I always tell new nurses is, EMS is maybe the only one who has the whole story. And when your EMS providers come in and be like, okay, I know she looks great, but you didn't see the car and the car looks terrible. And this person should look terrible. And it's a miracle they look okay. You're like, yeah, I gotta pay attention to that. So
the last thing I would say about the relationship between EMS and nurses is I think hospitals have understood over the last decade or so that EMS really should be seen as a consumer. And EMS providers have a choice in where they take patients. Yeah. And that means if they don't have a good relationship with you and they are equidistant to another hospital that can provide the same level of service and they have a better relationship, they're going to go there.
Yeah, for sure.
And the dollars for the patient are going to go with them.
Yep.
And they can really drive the success or failure of a trauma program, a STEMI program, a stroke program, a pediatrics program.
Yeah, you're absolutely right.
And EMS is really a pretty big player in the success of a hospital system.
You're absolutely right. They play a big role for sure. So
you got to treat them like a customer.
A nurse leader that I worked for a long time ago, his thing was always appreciate the EMS, always thank them for what they did, always take the time to listen to the story because they're the only ones that have the whole story. And a lot of times, a lot of nurses don't realize that, you missed that. There's a whole, I'll never forget a medic named Bob who came in with a patient and came in with this girl, looks fantastic, looks great. And he's like, Kevin, you didn't see the car. If you seen the car, you'd understand why I'm standing here in your trauma room. I know she looks fantastic. I know she looks great. She's smiling, looks happy. But she's 8 months pregnant and you didn't see the car. We're like, Roger that. Got it. Say no more. We're good. We're happy. You want to be here. We're here. And really treated them more like customers than not. It's kind of funny. The hospital I worked at before had such a bad relationship with EMS where, they're like, you could have went to any other hospital and you came here. Why'd you come here? Why don't you guys like us? And we're going, the patient says they're part of your system, then this is where they're going. So it's such a contentious relationship that it was like, why would you do that? Why have that kind of relationship with what's supposed to be your team? Right.
So I think it's so easy for people to get just kind of complacent and they work hard. People in the ER work hard. And if you have the choice or the chance of having a really easy day, you want that easy day. But I have a medical director in one of the hospitals I work in who had a really great way of saying, you got into this role because you said you wanted to help people. And so what I can't really tolerate is you saying that you don't want to help people. And so if you get to a place of where you don't want to help people, you don't want to work in our ER.
Yeah. Yeah. It's a really good point.
It kind of grounds you a little bit. And, those days you just don't want to do anything and you go to work and you think about that and it really kind of brings you back.
One thing, there's a nurse researcher named Lisa Wolf, who's just amazing and brilliant. And I can't say enough good things about her. But we were in a conversation once with a bunch of nurses, and she said, I will argue that you can't be a shitty person and a good nurse. Those two things just don't match. If you don't like people and if you're not good to people, you can't be a good nurse. You're never going to be a good nurse. You may think you're a good nurse. You may be a clinically competent nurse, but you're not going to be a good nurse. And right. I was like, I agree. I'm in. I agree with that 100%. I think that you certainly can't. You can't be a nurse if you don't want to take care of people, because that's what we do. And our paramedic partners are doing the same thing. As community paramedic becomes more and more of a thing, because I think it's certainly going that way. As it becomes more and more of a thing, what do you think nursing in general? What do you think nursing's role is going to be in that, or is there any?
I think nurses make ideal healthcare navigators. You take a case manager from the ER. A lot of the skills that your ER case manager has fits very well with the skill set that community health paramedics need.
100%.
And it takes a long time to teach that to people. So if you already have that knowledge and you're just using that knowledge in a different environment, man, that's useful. It took our guy, because I didn't have the resources that he needed. He had to really kind of learn a lot on his own. And it took him probably 2 years to kind of really get his feet under him. And now, he's fantastic. He's unstoppable.
That's awesome.
And once he's a nurse practitioner, his need for me will instantaneously decrease. And, he'll be very self-sufficient and just effective. He can get people admitted to rehab centers direct from home. He can arrange direct to psych facilities. He can arrange, home health and, primary care visits and all these things. It's just really, really neat. And I think the minute that he's an MP, he's going to be great. That's
awesome. What a cool thing. That's really, really cool. A lot of nurses, what I'm seeing more and more is I'm seeing more nurses now lately are, they're going from nurse to then paramedic. Mm-hmm. So they're going back and doing the paramedic after the fact. A lot of paramedics go through nursing school, but let's talk just briefly about the opposite. So people who are nurses who go back to paramedic school because maybe their flight crew requires. I know some flight crews require you have both.
Yeah.
What's your thought on that? What's your thought on people, nurses going back to paramedic school?
I think it's great. Honestly, it fills a void that, especially if a flight nurse is going to do scene response with EMS.
Yeah.
It is different enough in an uncontrolled enough environment where I really feel like people need to know what they're walking into, and they get that through EMS education. And they also get to learn a different set of skills. I remember how nervous paramedic students are to learn how to put in Foley catheters. You can imagine the terror a nurse has to think about when they've watched intubations for years by very qualified providers that sometimes get it right and sometimes get it really wrong. And then now, guess what? Now it's yours. Here you go.
Yeah.
That's intimidating. It's really, really intimidating. So I think it's great that nurses could have access to an EMS system, to an EMS program, and to go through that formalized training so that they're speaking the same language and they really understand what they're taking care of.
Yeah. What are your thoughts on the most traditional paramedic programs are about a year. There's a few very established programs that are much, much shorter for the right nurse, And I think the right nurse going through those programs, the one that comes to mind is Crichton has a nurse to paramedic bridge program. It's very short. It's very, I think you have to be a licensed EMT first to get into it, but it's a very concise, very lean heavy on your previous experience paramedic program. What do you think?
I've seen a lot of those. Just in the Houston market, there's at least 2, if not 3, of the junior colleges that'll offer an RN to paramedic program.
Oh, really?
Most of them require that you walk in with your EMT. In fact, I think all of them require that you walk in with your EMT. And then they'll look at your experience, and then it's usually a 3-semester deal to get you through. But they're looking to see that you have critical care and or ER experience to be able to do those transitions. They won't take someone that's spent their whole career in L&D.
Of course. Yeah.
Put them through,
Yeah. You're like, no, this program's not really for you.
Yeah.
So, but a very experienced ER nurse who decides that they want to go back and get their paramedic to make them more competitive for like a flight program.
Yeah. My program required all of the flight nurses to be paramedics. So you couldn't even get an interview if you weren't already a paramedic.
Nice.
You had to have, yeah. And again, I think it's largely around what's the mission profile of your flight program. If you do a large proportion of scene flights, having that EMS experience really is important.
Oh, it's the scene knowledge alone and the operational knowledge alone is huge. And of course, nursing never touches any of that stuff.
Right.
So that makes it kind of a unique thing. So yeah, I was curious your thoughts on that, because that's something I see, a nurse not too long ago asked me, like, hey, thinking about doing this to be more competitive. What do you think? And I'm like, that's not a bad thing. It certainly will make you more competitive. And I go, and one of the things I mentioned is that in some cases, you're not even going to get the call if you don't have that medic also, if you can't fill both seats. So
that's true.
So I think that's a cool thing. So that's one thing I always said I was going to do. I always said I was going to go back and get my medic, and never did. Life of course gets in the way, and I always think to myself, maybe someday. But I carried my EMT license for 12 years, 15 years that I had by since I've been a nurse, and only recently let it go. And it was just one of those, like, it was going to be too hard to renew this year with COVID and everything else. So finally I was like, well, I guess I'm going to have to let it go. And if I ever want to do that, I'll have to go back and get that basic again. But gosh, I taught EMT basic for years, EMT basic, intermediate, and even taught the paramedic level for years. And I have a special place in my heart for pre-hospital medicine. It's just so cool. So
I love it.
Yeah.
This is my 29th year of pre-hospital care.
That's awesome.
I never left it. So even when I was working as a nurse full-time, I was still doing EMS part-time, heavily part-time.
That's awesome.
Happy to say I get to do it again full-time.
I got to tell you, every time I go out, there's a couple fire departments real near to my house. And every time we go by, they're like, volunteers needed. And I'm always like, and my wife goes, like, you have time, like, for real. Like, she's like, get real. And she's like, yeah, like, you have time to do this. And I was like, if I did. And she's like, if you did, you'd be sleeping on the couch. And I was like, yeah, probably true. So
yeah, that's great.
This has been a lot of fun, sir. I really appreciate you taking the time to sit down and visit with me. It's great to get to know you. We're neighbors here in Houston, so it's great to know one more person here.
For sure. All right, Kevin. Great to talk to you. Thanks so much.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.